Emily is a 23-year-old registered nurse who presents today with symptoms of anxiety, restlessness, and feelings of suicidal ideations. Emily is married to her husband of 5 years. She works at the local home health agency, Hamilton Square Home Health. Her husband is an investment banker at Synovus Financial Services. She is currently on no antidepressant medications, no anxiety medications, and takes Tylenol for headaches from time to time. She was referred to me by a friend at her job. She presents with a bachelor's degree in nursing. She has no history of drug or alcohol use or abuse. She stated that she drinks on occasion. She is well dressed and well groomed, speaks eloquently, and was somewhat reserved during the first session. Scene one. Hi, Emily. How are you today?
I'm good. How are you?
I'm doing fine. It is very nice to see you. Thank you. Come in, have a seat. And please tell me what brings you to the agency today.
Well, one of my friends suggested that I come talk to you, and I just had a few concerns about my marriage and possibly have made a decision that I would like to speak with someone and kind of work through.
Okay, I see. So, um, tell me about your husband.
Um, well, he, of course, works for a financial company. We've been married for about 5 years, going on 5 years this year. And, I work hard, he works hard. He's a really sweet guy, a great supporter. But just lately, over the past few years, he's just gotten a lot more aggressive. And, I try to do the right things. I come home and cook him dinner, and, you know, um, I feel like I bring just as much to the table as he does, but I just am really confused about his new aggressive behavior.
Okay, so please tell me what decisions, because you stated earlier that you think that you need to make a decision about your marriage and that you don't know how to tell your husband. Can you tell me what decision or decisions you have made and what brought you to these decisions?
Well, like I said, he's just been really aggressive the past, few months, and I'm sure that it's my fault. I'm sure that he's just been really tired, and I'm just trying to find guidance to see what, I should do, or how to confront him, because at this point I just don't know, you know, if he's tired, I don't want to, upset him anymore. And I should know when he's tired and when he's not. But there's just been some changes, and I just want to make sure that I'm working through them appropriately.
Okay. Do you feel like you are interested in saving your marriage, or would you opt in or out for marital counseling?
Absolutely.
Okay. Maybe once you and I build a rapport with each other, and we get some sessions going, do you think maybe we can invite your husband to some sessions?
Well, like I
Well,
told
we'll
you.
take baby steps.
Okay.
I want you to feel comfortable in your own skin talking with me first, and then once we get to a point in the sessions, to where I feel like, okay, we've gotten further than we were initially, then we can proceed with possibly inviting him in, and then you just talking with him and letting him know how you feel, where you are coming from, and how you feel that his um, being aggressive with you at times and talking with you at times makes you feel. Would you like to do something like that? Do you think that is helpful for you?
Sure, definitely helpful for me.
Would you be willing to participate in implementing a plan for you? What I like to do with my clients, I like to develop a goal or some type of implementation to where we set out goals together. You tell me what you want to do going forward, such as like meeting with me, having sessions together, and then eventually having sessions where we invite your husband so that we can maybe even offer counseling sessions for him. So I like to engage my clients in that decision process. And I also want you to know that you can talk to me in confidentiality, as long as you don't threaten to hurt yourself or anyone in any kind of way. I promise you, what we talk about will stay in my office between the two of us. Now, if you don't mind, I do need to ask you a couple of more questions. Has he put his hands on you or hit you in any kind of way before?
A few times.
Okay.